On the Medical Watch, healthcare workers on the other side of caregiving during this pandemic.
Yeah, Dina Bear is here with their remarkable story of survival.
He's an emergency room doctor. She's a nurse in the neonatal intensive care unit. Both worked on the front lines of the COVID-19 crisis, then became patients themselves. But the infection took a catastrophic turn, leaving the fate of the two devoted caregivers in the hands of organ donors and transplant surgeons right here in Chicago.
I was tired. I couldn't breathe quite as well. I was short of breath, and it was becoming worse and worse.
A neonatal intensive care unit nurse, Carrie Wegg, has spent the last 25 years caring for sick babies.
It's less likely that children and babies get COVID and get sick from it, but there's always that possibility. We were, however, having to take extra precautions because of the parents may have COVID.
When she started to feel sick in July, she was quickly admitted to an ICU in Indianapolis, where she lives with her husband and two boys, Gavin and Gunnar. Not long after, she was sedated and placed on a ventilator, then ECMO life support, the machine doing the work for her heart and lungs for 12 weeks.
All those months were gone.
As the 48-year-old with no comorbidities deteriorated, her husband Rodney fought for her life, advocating for Carrie's transfer to Northwestern Memorial Hospital and the opportunity for a lung transplant.
They told me my only two choices were death or lung transplant. If it weren't for him, I would have probably been dead by now. He did not let me go.
These patients are the sickest of the sickest. Their body is basically barely holding on to life by the time we're seeing these patients.
Thoracic surgeon Dr. Samuel Kim helped perform Carrie's transplant on October 2nd, just days after operating on another healthcare worker, Dr. Andrew Lawrence, an emergency room physician from Texas.
I would see probably about 10 to 15 patients per day who are potential COVID patients. And as it gets worse, almost 90% of the patients I see would be COVID exposed. You know, I view it as my job. I view it as my calling.
But by mid-July, Dr. Lawrence became a patient himself after experiencing shortness of breath and fever.
On the 22nd, I got so sick, they had to drag me into the ER, and I was admitted to the ICU.
His condition quickly declined, and the 54-year-old was ultimately transferred all the way to Northwestern, where he received a double lung transplant in late September.
The tissue plane that we're able to create to remove the lung gets very challenging due to all the infections, inflammations. Certainly, all our lives, and both, other surgeons who are very experienced and myself, we've never seen anything like this, even on the most challenging lung transplant we've done prior to this.
For Dr. Kim, caring for the two frontline healthcare workers has been deeply personal.
These are the true heroes who are risking their lives every day, go to work so that they could take care of the patient in this pandemic. For a brief moment, I think about, that could be me.
Now, after months in the hospital, both Carrie and Dr. Lawrence are gaining back strength and starting to walk again.
I'm very happy. I'm very grateful.
You don't know how precious life and breath, breathing is until you don't have it. And now it's even more precious than ever.
Dr. Samuel Kim and the team at Northwestern have performed 7 double lung transplants in patients who experienced a COVID cascade. He says it takes a Herculean effort to save these patients. Back to you.
That really brings it all.